is the responsibility of every parent to provide good health care for their child. Not only good health care, but the best health care that they can get. However, sometimes this is not possible because medical services are often very expensive. According to United Nations report, Sub-Saharan Africa remains the region with the highest under 5 neonatal mortality rates in the world. A child born in Sub-Saharan Africa is 9 times more likely to die in the first month of life and 14 times more likely to die before reaching age 5, mainly from preventable causes. Around the world, there are various programs that are offering free medical services for children, and one of them is right here in Hargeisa. Today, we welcome you to a new series of Health Talk with me, Wangoi Ngoge. Today, we are at the Mohammed Adan Sheikh Children's Teaching Hospital. The hospital is named after the late Mohammed Adan Sheikh, who was among the first Somali surgeons. He longed to build a children's hospital in Mogadishu, but due to the unending conflict, he decided to implement it in Hargeisa. After his death in the year 2010, his wife Felicita Torrielli and his Italian friends raised funds to establish the hospital. And joining us is the director, Dr. Kadra Ibrahim.
Mohammed Adan Sheikh Hospital, it is only one hospital who is specialized in pediatric or children under 14, under 14. So we treat under 14. And our hospital is a charity hospital. It's a public hospital. It is under the government right now, and it started in 2011. This hospital is not only giving the services of Somaliland. The children, they are coming from everywhere. They are coming from Somalia, they are coming from Ethiopia, the Kililka, the state, 50 states, I don't know, something like that. They are coming from Poland, so all neighbors, they are coming. The doctors who is working here, they are the doctors who graduate from local, I can't say it's a university, our universities, Hargeisa universities, Amud universities, now it's Bra too, but most of them, they came from Amud and Hargeisa university. They get trained from Italian experts who came here and trained them. The nurses have the same thing, and they trained the expert from Italy. So they are really giving a good services here. So we have 2 doctors who is sitting there in the OPD. So the hospital have a different, the different departments, starting with the triage, OPD, and then inpatient.
Inpatient, what's the bed capacity?
The inpatient, what we have, it is 37 beds capacity. The hospital work 24 hours, it's open. And we take an emergency cases, and we have a newborn and neonatology section, and we have what we call isolation area. So the communicable disease, we treat that. So it's a separate with us, and we have nurses and doctors, 7 doctors. We can say 19 nurses.
So what do you do on a daily basis?
Daily basis, I have 2 jobs. One is to treat the patients. Second is to organize or to meet or monitoring the activity in the hospital.
Okay. Is it a busy hospital?
It's kind of a busy hospital.
Okay. So what kind of diseases have you dealt with?
Medical illness of pediatric. Mostly is related to the respiratory problem, chest infection. Sometimes with GI problem or gastric, diarrhea and vomiting. Sometimes related to neurological, some seizure for the children. Is also we deal with the new baby born have illness after the birth. So basically every medical illness of the pediatric or the children. It started from 1 year, 1 hour old days until 40 years old. Yes.
How about the medical students who come here for training?
Yes, we have a collaboration with the University of Hargeisa. and health science institution for the nurse, which they send them student, nursing student, laboratory student, medical student. Also, there is a student coming from outside of Hargeisa, study from Uganda, study in Kampala, study in China. They come in to work in or volunteer in our hospital. Yeah.
Are you happy working here?
Yes, very happy.
Are you
Very.
proud of it?
Yeah, very much.
Would you tell people to come to this hospital?
Yes, yeah, I hope, because it's only the pediatric hospital in Hargeisa or in Somaliland is a kind of referral hospital which is unique in our country, and I hope we continue for a long time, and all the people they will contact in our hospital for sure. I'm proud to work in Mass Hospital.
The hospital offers a comprehensive variety of inpatient and outpatient services ranging from postnatal care, medical and surgical care, nutritional, laboratory and rehabilitative services.
What we offer is a hospital and our services. It's we can say it's a free of charge most, because when the patient come, we don't ask a ticket, what we call, or we don't ask a fee. They come in, and then we treat the patient, and if they need to be hospitalized, we hospitalize. It's an inpatient. And we also now, you know, the community, we have to doing now community, they have to understand at least this is a hospital, so they have to give at least something. So now what we do, it's we charge some small, very small money, kind of medicine or lab or something like that. But most of them is free. We give us free. How much kids we treat per day? Between 40 to 60 we see, depend on season and season. Sometimes they come 30, sometimes they come 20, but most of them is it's, you know, the statistics like that is between 30 and 60. The bed capacity, it is it's not enough, so the hospital need an extension. That's what that is one of them. Other thing is what we need. It is we need doctors who has specialty, especially neonatologists, pediatricians, experts. Those we needed, because those young doctors, they need a motivation. They are eager to learn. And nurse, the same thing. So what we need is you know, to come this country, more expertise. And for us, what is more unique, it is the quality we are giving. That's the quality. I'm not saying the other hospitals, they are not giving the quality, but what I'm saying is, it is we are more specialized. The people who is working, the nurse, the doctors, they are just stick with that specialty for the children. So what we are offering, it is a more quality and can I say ethics and more humanitarian and all this. It's making a unique this hospital, and I am planning to have an extension this hospital, because as I said, our capacity, the hospital capacity, it's a very small. We have only 37 beds. So I would love to have more beds, more departments. And what we are missing, yes, surgery we have, and it has to be functioning, that surgery. Another thing is if I could get the specialty, those doctors to get specialization. So that is it's my plan, and I'm hoping the government will help me with that. An extension of the hospital, getting offering better services and expanding. Why not? If the government offer, I will encourage the doctors who is working on board and they are from Somaliland, come back to the country and help your people. You can come and give your knowledge those who need it.
Thank you for tuning in to the show. Look forward to another edition next week, same time. On behalf of CBA TV, it's goodbye for now.